Welcome to this crucial episode of Safe Schools Rainbow Roundtable. I'm Dr. Dan Sheridan, host of Safe Schools Rainbow Roundtable, and tonight we delve into a profoundly important conversation about HIV and AIDS education. This isn't just a health issue, it's a matter of social justice, equity, and community well-being. We're here to unravel why learning about HIV and AIDS is not just a necessity, but a right for students, especially those in high school, where relevant, real-world information can literally be a lifesaver. We'll explore effective educational strategies that go beyond outdated, ineffective policies and challenge heteronormative narratives. We have an impressive lineup of panelists who will share their expertise and insights throughout our discussion. Our Rainbow Roundtable will look at a historical overview of HIV and AIDS. We will discuss real-life experiences, examine tools and resources available for our students, and then look at our future. In our historical overview, it's essential to know how we got here. Our historical overview will trace the roots and evolution of HIV and AIDS from its emergence to current day. We'll look at events, decisions, and figures that have shaped the public health response and education regarding this epidemic. In our real-life experiences, we move to the heart of our discussion. We'll hear fictional yet realistic scenarios depicting a high school student's journey following potential exposure to HIV. These stories are paramount in showcasing the critical steps to take post-exposure and emphasize the vital role that education plays in such pivotal moments of young lives. In our Tools and Resources segment, we preach knowledge is power. We'll spotlight what's available right here in South Florida for HIV testing, as well as online resources that bolster or supplement school programs. We'll also discuss the significance of medication for pre-exposure and the impact of maintaining an undetectable viral load. In our future outlook, we'll discuss the collective action needed to achieve the ambitious goal of 0 new HIV infections. We'll explore new technologies, medications, and community strategies that could revolutionize our approach to HIV prevention and education. We thank you for joining us on this journey today. Before we dive deeper into our discussions, I'd like to introduce our esteemed panelists and share a bit about their connection to today's theme. Let's welcome Harold Marrero. Harold is the COO of Safe Schools and executive producer of Safe Schools Rainbow Roundtable on Happening Out Television Network. Welcome, Harold.
Thank you for having me. Glad to be here.
Let's welcome Tiffany Williams, the Director of Outreach for Safe Schools. Tiffany is also a pop culture guru and host of the streaming podcast, Tiffany Explains It All. Welcome, Tiffany.
Hi, I'm so happy to be here and have this discussion. I think it's really important to talk about the subject matter that we have ahead.
Absolutely. And let's welcome David Torres. He is a student at Miami Coral Park Senior High School. Welcome, David.
Thank you for having me. Thank you, Danny.
And let's welcome Star Aditya, representing one of the world's most important advocacy organizations in HIV and AIDS prevention and treatment, the AIDS Healthcare Foundation. Welcome, Star.
Yeah, happy to be here. Thank you.
You're welcome. And finally, we'll welcome Christian McDonald, a PhD candidate at the University of Miami. Welcome, Christian.
Hey guys, welcome. Excited to be here.
Thank you for setting the stage with us. Before we can explore the present and the future of HIV and AIDS, we must delve into the complex tapestry of HIV and AIDS history, a journey marked by medical challenges, social stigmas, and extraordinary human resilience. Our exploration today is not just an academic exercise, it's a crucial step in understanding how the past shapes our present response to this ongoing epidemic. Our story begins in the late 1970s and early 1980s, when a mysterious illness began to surface. Initially dismissed as isolated incidents, the alarming rise in cases of rare infections and cancers among certain groups, especially gay men, intravenous drug users, and Haitian immigrants, signaled something far more sinister. The world was witnessing the dawn of the AIDS epidemic, but it had yet to understand or name it. It wasn't until 1981 that the Centers for Disease Control and Prevention published a report about a rare lung infection seen in 5 young, previously healthy gay men in Los Angeles, an event often considered the official beginning of the AIDS epidemic. By 1983, scientists identified the human immunodeficiency virus as the cause of AIDS, demystifying the agent behind this relentless disease. As the 1980s progressed, HIV and AIDS exploded into a global crisis. It crossed borders and continents, affecting diverse populations. Unfortunately, the response was marred by stigma and discrimination, particularly among the LGBTQ+ community, drug users, and ethnic minorities. This prejudice not only hindered effective public health responses, but also ingrained deep societal misconceptions about the disease. The 1990s marked a turning point in the fight against HIV and AIDS. Activism, led by groups like ACT UP, was pivotal in advocating for faster drug approval processes and more research funding. The introduction of antiretroviral therapy in 1996 was a game changer, transforming HIV from a death sentence into a manageable chronic condition for many. As we entered the 21st century, the global community intensified efforts to tackle HIV and AIDS. Initiatives like the President's Emergency Plan for AIDS Relief, also known as PEPFAR, and the Global Fund brought unprecedented resources to the fight, significantly reducing HIV-related deaths and mother-to-child transmission rates worldwide. Yet, challenges persist. Access to treatment remains unequal, and specific populations continue to be disproportionately affected by HIV and AIDS. Social stigma, discrimination, and lack of education exacerbate these disparities, reminding us that our battle against HIV and AIDS is far from over. As we reflect on this history, it's clear that our journey has been marked by both heartbreak and hope. So to our panelists, what else can you add to this historical segment? Is there more that you can add to this history that we're discussing today?
I would love to add
Go for it.
Ryan White. And I think that Ryan White was very pivotal to the awareness and who could get HIV, and the sympathy that came with a teenager who was infected with HIV through through a blood transfusion, and that changed the face immediately, and it started to change hearts. But that was after a teenager had to deal with, that stigma and going to school and fighting for his life, and he did it very publicly. I'm from Indiana, so Ryan and I was around when we were trying to figure that out, and as a young child going, well, that's not fair, and well, if this is the information and if they can't spread HIV, then why can't they go to school? That changed my whole way of looking at how adults still, discriminate. And so it was very personal for me, because my mother worked for an organization, and the person who led it was HIV positive, and died of AIDS later. And this was early 80s, but it was something where I didn't know if I could hug him, but then as I, think about when I thought about the Ryan White and everything else, I was just like, there's a mismatch in what I'm seeing in the media, and hearing in the streets, and then seeing in real life.
Yeah. I mean, I think that it sucks that somebody like a teenager had to go through that to actually draw attention and awareness to the situation. Like you said, that you were young and that it was one of the first things that impacted you, right?
Yes.
I think that it shouldn't be that we let that something happens first for us to pay attention. It should be the second something happens, we should take notice and take charge against something such as prevalent as HIV, because we shouldn't have somebody as like a martyr to represent that we should make change. We should, the second something happens, start and strive for it.
And I love that you used the word martyr, because he was. And it wasn't until, later that then, when he was able to have, people who were coming to his aid, like Elton John, and Michael Jackson, who's also from Indiana, and Elizabeth Taylor, to go, hey, we're putting some power behind this child, but also with all of the people who are dying from this and people are still being treated a certain way. So then it's like after in death, we go, oh, we could have done this better. But it was like, that's what we do with martyrs. It's like we vilify them, we persecute them, and then when they die, there's a foundation.
And it shouldn't ever be that way.
Yeah. And the fact is, when HIV started to affect the LGBTQ plus community, when it started to affect minorities, there should have been a movement in not just the medical field, but even in the response that the government would do to not just learn why the virus was affecting the certain communities, but learn how the virus was affecting the community, and done it in a way that did not vilify the people that it was affecting, that it didn't vilify the way that they were being affected, and that looked at it from a much more comprehensive way to see how we can stop it. Because much like, you can see similarities between when HIV first started and then how COVID started. We saw how the virus, which is like, it started and then we started to hear news reports and no one really understood what it was, but there were many points in time that we could have responded to it and not have what we saw, which was the spread of COVID that happened in this country. When HIV first started, if the government would have responded, if the medical field would have responded in a way that would have been better, a lot of people could have been better informed and a lot less suffering would have happened.
I think COVID was a great example, actually, because what we first did, we closed all of our doors and we isolated the people that were affected. That's exactly what happened when AIDS and HIV first started. And coincidentally, the minority groups like the LGBT community and the Haitian immigrants, my bad. Those were specifically the type of people that were seen like that they didn't want to be treated. Like nobody wanted to treat them. They wanted to exclude them, which was the problem at first. That was the very precipice of it all. That it was postponed so far because of a hatred that was already there.
Right.
I think that it's still relevant today, if you think about it, even in social media. And it's interesting that you made the comparison to COVID, because it is true. And it's so interesting that people in power who are mostly, let's be honest, like white older men, and they're the ones calling the shots, and yet the people who are suffering are, again, minorities, the LGBTQ plus, disability. And they're just like, well, that's not my problem. Like, it's like almost they're saying the quiet part out loud. They're literally saying, like, we don't care about these people. So we're just going to quietly let this kind of keep going, let this keep festering until it kind of just takes them out. That's literally what they're doing. Mm-hmm. And it's so interesting, too, because if you think about it, during the HIV and AIDS epidemic, there was no talk about safe sex, let's be honest. There was no such thing as that. And on top of that, you didn't talk about it because it was a taboo topic, And on top of that, there was also no safe sex for the LGBTQ plus youth at the time. So there's no protection. And again, I do agree that there should have been more emphasis from the government to kind of destigmatize that, because how quick is it to just say something and then someone tells it to another person, and slowly the thing that you said to that one person becomes a whole completely different subject matter to like the last person in the line. Mm-hmm. It's like a big game of telephone.
If they wanted to, they would. They would have.
Well, and I think, and the reason they didn't, and this was in our government, this was definitely pushed in media, which I'm sure was pushed by the government, to talk about it was a gay disease.
Yeah. A grid.
And it goes, and it was, I just remember watching daytime TV with my grandparents and seeing those topics and how it was like, it wasn't, well, here's the panelist, they're HIV positive. No, it was, these people are HIV positive and we don't know why, and it was definitely because you're gay.
Yeah.
Right? And so that's, going back to the whole idea of white and right, middle America, literally, white male, straight, and Christian.
Right.
And because it also became a thing about your moral values. We don't talk about sex because good Christian folks don't have sex until they're married, and
Right.
that's to procreate.
Right. And not to mention that, there were many spaces that the word "these people" wasn't even used. It's these perverts.
Right.
It wasn't even the fact that they were seeing the LGBTQ plus community as a, as a non-judgmental, number.
They weren't treating it with the kindness that
Exactly.
the situation deserved.
Exactly. They were like, oh, they almost deserve it because of their perverse lifestyle, because
Yes.
of who they are.
This is ordained.
Yeah, and when you talk about the African American or the African immigrants that were coming here, or the Haitian immigrants that are coming here, again, they don't care about those people. So why it's like whatever preconceived notion you have about that group, this is the reason why. Like, this is why they have that. This is why this is affecting that community. And that was really unfortunate, because I feel like this country could have done a much better job at stopping the spread and understanding the spread and containing it than what we did. And so many people suffered, and there were people that didn't have families. There were people that their families had shunned them. Their families had kicked them out of their house. And I always think about during this time, it's like how many young queer men died by themselves in hospitals, and how sad that must have been.
Yeah, I think it's a really important discussion to have, because I think you start for beginning the conversation with a name, right? And I think so much, especially in the scientific community, when we have lectures on HIV or other kind of viruses, or even conversations about where we are with vaccines and therapeutics that we'll talk about a little bit later, a lot of people are very unfamiliar with the social, historical perspective of how, the advent of, the emergence of HIV is pretty well known and well established. And, people know that history, but no one knows what was going on kind of politically and socially at the time. And, Dan had mentioned previously about ACT UP and in these important movements that were occurring at the time that were instrumental in ensuring that we got the important therapeutics for individuals, right? And so I'm really glad that you started with that, because so much in science and in research that I've been involved in, in those spaces, that is not something that is really talked about, right? It's more just about kind of the nitty gritty, what are the experiments we're running, what's been published already, how are we moving forward with this? But names aren't really talked about, right? And obviously there's importance in maintaining anonymity in cohort studies and different in those kinds of designs, but we don't really think about as much as in the biomedical science community, where we're doing this to enhance therapies for people, right? Usually, though, it's kind of that more macro kind of perspective is kind of lost, right? And you kind of get focused in so much on the science of it, right, and not the humanity of it, which is why we're doing what we're doing.
Mm-hmm.